Okay. Okay, let's see. Can those of you on Zoom hear me now? Oh, you can hear through there. Okay, so I'm not sure why it's not picking. Oh. Oh, okay. I think. Got it. Okay. Okay. So sorry guys about that. Let me mute me. Okay, so sorry guys about that on Zoom. It should be fixed now. I just gave a quick intro for Nicole, and so I'll let her get started.
Okay, perfect. Thank you so much for the intro. So, again, my name is Nicole. I'm a speech therapist. I'm about a year and a half into my clinical journey, so I'm going to be going over just my professional path, and then some lessons that I learned along the way. So we're going to be going into an overview of my professional journey, some research I did in grad school about burnout, some professional lessons learned, some life lessons learned, some advice from seasoned clinicians for new grads, and then some final thoughts, and we'll leave some time for questions. So this is an overview of my professional journey in speech therapy. In 2021, I graduated from Stockton University, where I received a Bachelor's of Science in Health Sciences with a concentration in communication disorders. In 2022, I began my master's program at William Paterson University, where I worked as a graduate assistant, and I also completed coursework, externships, and a research project. This was a 2-year program, so in 2024, I graduated, where I received my Master's of Science in Speech Language Pathology. And I then began my clinical fellowship year, which is a 9-month period of supervision. It's necessary for licensure. And I completed that in 2025, and that's where I am now, fully licensed SLP. So while I was in William Paterson, I had a lot of different professional and clinical experiences, one of which was a graduate assistantship in the Honors College, where I supported administrative projects, faculty initiatives, and student programming. This was such a great opportunity to work for the university and receive a little bit of help financially. So I highly, highly encourage everyone, if you feel like you need more professional experience, look for these opportunities. This isn't unique to William Paterson. A lot of universities have graduate assistantships and scholarships. It is very rigorous, and it takes a lot of accountability and discipline and time, but it's worth, gaining a lot of professional experience. So while I was a graduate assistantship, I worked in the William Paterson University Speech and Hearing Clinic, where I treated clients across the lifespan. I then started my externship at William Paterson or at Wayne Public School District, where I evaluated and treated students from kindergarten through 5th grade. And then I completed a medical externship at Mountainside Medical Center. It's in Montclair. It's a hospital where I did inpatient and outpatient work, mostly in swallowing, voice, speech, language, cognitive linguistics, and myofunctional therapy. So like I said, in grad school, we did some research. We had a research project, and our group decided to look into the prevalence of burnout in speech language pathologists and interventions that might mitigate burnout. So we specifically looked at the prevalence, contributing factors, intervention methods for burnout across mostly SLPs in medical and educational settings. So this study looked at 2 specific factors. We looked at the cause of burnout. So we used questions from a burnout assessment tool, Core Symptoms, which is a validated psychological assessment to gauge respondents' perceptions of burnout. And respondents were asked to rate their agreement with certain statements from almost all the time to never. And then we also looked at strategies to mitigate burnout. So this might be interventions that can help alleviate stress. And we asked that participants specified the practices and the frequency of engagement. So the overall results is that everybody feels burnt out, which is not shocking, but the scores fell within occasional to often range. And this just indicates that there's a very meaningful presence of burnout, especially in the field. So specific results from the burnout assessment tool is that people felt or identified with mental exhaustion and mental distance, where this was the highest rated burnout indicators. We also looked at the highest rated burnout perceptions, and people felt like inadequate pay and the effort, reward imbalance contributed to burnout. So this kind of indicates that many clinicians felt that the amount of time or effort or responsibility that they were putting into their job wasn't adequately matched by any financial recognition or organizational support. So we also looked at the strategies to reduce stress. A lot of participants reported that they participate in reading, music, arts, and other entertainment. They also spend time with friends and family. Vacation and travel was a really big response, and also exercise and staying active. So this kind of highlights the importance of having, having hobbies outside of work. But why is this relevant to us? So anticipating and understanding burnout can really help us while we're entering the workforce, especially while you're a student as well, because you might be feeling burnt out as a student. So it's important to define personal factors of success and job satisfaction early on. This might be different for some people. Some people might feel like salary is important, work-life balance is important, opportunities for leadership is important. For me specifically, when I was starting to work, I really wanted to work on financial stability, but also advancements or opportunities for diverse populations. As a result, I sacrifice a little bit of my work-life balance. I work weekends, I work holidays, but this is something that I had really reflected on early on in my career, and it's something that I anticipate and I feel more prepared for. And that kind of goes on to the next point where it can help us prepare for workload demands. A lot of times, especially in healthcare, there's productivity standards, there's really strict deadlines. So understanding and anticipate these workload demands can help you feel more prepared to reduce burnout. We can also consider the importance of workplace environment, and this can be mentorship, collaboration, working with colleagues, reasonable productivity, or even organizational support. When I was actually applying to different jobs, I was applying to different hospitals, and I could tell that one of the hospitals had a really, really strong interpersonal relationship with each other and with other professionals. And the other one was more independent. And I knew for myself, I really wanted to work on a team. I wanted to feel like I had support from my coworkers, and I ended up going that route. And it's so important to have a good workplace environment and to feel supported. And then also you can develop resilience and coping strategies early on. And this is a really, really great time to do this. So think about things that make you happy, things that support your mental health. For me, I really like to read. It's something that I kind of lost. I was a very avid reader when I was in middle school. And then through school, I kind of lost it. But now that I'm working, I realize that I really enjoy it. And so I'm trying to get back into reading, but this can look different for everybody. This can be sports, going out, anything. So you could use this time to develop really healthy coping strategies. So going back, I had 2 externship experiences, and this really significantly shaped the direction that I went in my career and the type of work that I pursued. For those of you who don't know, who are outside of speech, it's a very broad scope, but there's typically 2 different ways you can go. You can go medical or you can go school. And this is something that constantly through school you're questioned on. It's, are you going to go medical or are you going to go school? I personally thought I was always going to go school, work with kids. I babysat my whole life. I'm really comfortable with the pediatric population. I have a laminator. I was ready to work in the school. And I was not even considering medical in the slightest. It actually really, really intimidated me. So much so that I went to my externship coordinator. I said, please, just put me in another school. I can't do the medical externship. And she said, you know what, Nicole, have an open mind. You might like it. I said, okay, I'll go in the hospital and I'll just try it out. So I went to Mountainside Medical Center and I hated it for 2 weeks. I was so nervous that my Fitbit would tell me, ask me if I wanted to log a workout because my heart rate was so high. It was terrible. But I kept going and I kept trying and I had an open mind. And by the end of the externship experience, I loved it. But I still was very, very intimidated by it because now, everything that I had thought for my career was just shaken up. I had no idea what I wanted to do. I can either take a risk and go medical. It's very difficult to find a medical job when you're right out of school because, people don't want to take the time to train you when it's such a high stakes environment. Or I can do what I was always planned to do and I could be comfortable and I can go into school. But this, after seeing both, for me personally, the work that I would be doing in a school didn't feel as fulfilling as the work that I did in the hospital, for me personally, and just what I was looking for. So I, reached out to a lot of different people, and I actually reached out to another William Paterson alum. And she told me about an opportunity at Holy Name Medical Center. And she said, we have a position open, and it's actually both, a little bit of both. So you work inpatient, you work in the hospital with very complex patients, but then you also work outpatient. And I thought, oh my gosh, like this is amazing, the benefits of networking. So now I'm a full-time inpatient, outpatient speech language pathologist at Holy Name. It's a 360-bed acute care facility. We treat a large patient population in that region. And it's also a accredited stroke hospital. So we get a lot of stroke patients and a lot of very neurologically complex patients. So kind of looking back on the path to practice, like just to kind of pause and just reflect, from all the time that I was through school to the time that I was hired, some important things to remember is to pursue scholarships, assistantships, and internships. Oftentimes, the internships will lead to new jobs or lead to networking opportunities, and this can help you so much. Especially where I work, actually, one of my coworkers was a student, and she loved Holy Name. She wanted to work inpatient so bad, but like I said before, it's very difficult to get into a medical facility early as a clinical fellow. She actually went and worked at a skilled nursing facility for a little bit, and then as soon as a job opened up, she came back to Holy Name. So make sure that you're making a good impression in your internships, but also take the time to really look for meaningful internships or assistantships that can help you. Also, network early and intentionally. And networking can mean building relationships with professors, with students, with people in this room, supervisors or alumni, because they can open so many doors that would typically be closed. Also keep an open mind about career paths. If I hadn't had an open mind, I would be missing out on such amazing opportunities that I'm receiving in the hospital. And the path might not always be linear. And it's just kind of important to remember that it's okay to deviate from what you thought you wanted. And always try to be a little bit uncomfortable. And what I mean by that is that growth doesn't typically come from being comfortable. I felt like the school was a safe option for me, again, because I was so familiar with it. But I'm so happy that I decided to go a little bit more medical because I feel like I'm challenging myself every day. Also, do your research and advocate for your goals. Learn about different opportunities and pursue what you feel like will align within your short-term, long-term goals and interests. Also, just keep going. That's it. Keep going. So going back at Holy Name, I do inpatient and outpatient. So what does this mean? On the inpatient side, I evaluate and manage dysphagia, speech, language, and cognitive communication deficits. I also perform bedside swallow and communication assessments. I perform instrumental swallowing assessments like modified barium swallow studies, which are x-rays, like you can see in the picture below. I implement targeted interventions to begin the rehabilitation process. So we use a lot of the data that we get from our assessments and implement them into individualized plans of care. And I collaborate really closely with the interdisciplinary medical team, like the doctors, the nurses, dietitians, and the patient and patient's family, which is really important. And then on the outpatient side, I evaluate and treat speech, language, and swallowing disorders, mostly for pediatric patients, but we do have a little bit of adult patients. I develop and implement individualized evidence-based treatment plans and provide weekly therapy to a caseload of about 35 pediatric patients. I make sure to implement caregiver education and home programming. And then I also collaborate with interdisciplinary providers and educators like teachers, pediatricians, audiologists, and also like the school SLPs as well. So now I'm going to talk about my professional lessons learned, and these are very honest. It's things that I wish that people discussed more. It comes from real life experiences, but it's stuff that I wish that people had shared with me. Give me 1 second. Bear with me, I'm kind of going through like a sinus infection. I'm going to try to project. So the first one is that confidence comes with time. So you're going to feel like you're a little fish in a big pond. You probably felt like that going into school as well, that everybody knows so much around you. And again, you're like a little fish and you're with a lot of people that are very intimidating and you feel like you won't fully belong. And this kind of leads to imposter syndrome. Everybody's probably heard of imposter syndrome, but it is so real. And it's that feeling that you are incompetent or that you don't know as much as the people around you. But confidence doesn't happen overnight. It happens gradually through a lot of experience and repetition and exposure. Being insecure doesn't mean that you're incompetent. It just means that you feel insecure, and this isn't often the reality. It's also important to know that your voice matters in clinical decision making. You are trained as working in health sciences to observe and analyze and make clinical judgments. So use your voice. You have such a unique and fresh perspective. There's people that you will be able to run circles around. There's usually often debates between younger and older clinicians, especially in the speech therapy world, because again, technology and research is always shifting and standards and best practices are always shifting. So there's always debates. So don't underestimate the stuff that you've been taught while you were here, as it's most often the most recent research and the best research that's coming out. Make sure you also speak up and use the tools that you've been given to support your decision making. And then there's also a balance in this. So make sure that you're being confident and not cocky. Being confident just means that you're being prepared and you're trusting your training, but you're recognizing that you're still growing. In science, usually the best clinicians are the ones that stay humble, stay curious, and they continue to learn and understand that there's always going to be stuff that you can learn from the people around you. Something that kind of helped me understand this is something called the Dunning-Kruger effect. You may have heard of it, but it basically describes how people with very little experience often overestimate their abilities because they don't yet recognize the complexity of their field. On the other hand, people who have more training feel less confident because they are aware of the gaps in their knowledge. So this awareness doesn't indicate that you're incompetent, but it really indicates that you have a growing clinical insight. So the next one, credibility is established through consistency and preparation. Coworkers will rely on you, your students, some of your colleagues or just your friends, they rely on you. So work on how you can be prepared and how you can follow through on what you say you're going to do. Be predictable and well prepared. This looks like coming into work on time, reviewing charts, understanding plans of care, being organized. When coworkers understand that you're consistent, they begin to trust you. And professional trust is built through reliability. So if you say you're going to do something, make sure that you're doing it and make sure you're doing it thoroughly. Also be aware of expectations, and these can be spoken and unspoken. There's often expectations for documentation, professionalism, patient care. Sometimes if they feel gray to me, I'll go into my manager's office and I'll say, hey, can you explain this to me? This feels a little bit gray to me, just so that I can make sure that I'm meeting your expectations. And a lot of managers will respect that you're going up and that you're inquiring about this rather than just guessing what the expectations are. Typically, credibility isn't established from one big save the day moment. It's typically small moments that are building up over time. So the next lesson is communication is essential. So clinical knowledge is very important, but if you can't communicate your observations, you can't communicate effectively, especially with the team. Clear communication ensures that everybody understands the patient's needs. So make sure that you're being clear, concise, and direct. Strong communication also means knowing when to ask questions. I always thought that the worst thing that I can ask or worst thing that I can say is, I don't know. Like going up to a doctor, the scariest thing I could say is, I really don't know. But in fact, the worst thing that you could do is give the wrong answer because you're too scared at the time to look up the right answer. There's doctors all the time that come to me and they're saying, I don't know about this. And I think it takes a level of humility and understanding for them to even be able to admit that. So don't be afraid to not know and don't be afraid to ask questions. Be very clear on the limitations that you have. As a new grad, you might have a lot of limitations because, again, the field is so vast. There's going to be stuff that comes up to you and you're not going to know the answer. And it's okay to say, you know what, I don't know the answer, but I'm going to find out. Or I don't know the answer, but I'm going to find someone who does. So make sure you're also following through. Raising questions it's really a clinical responsibility, and it's not only appropriate, but it's completely necessary. And safety depends on you communicating clearly. Also, make sure your suggestions, recommendations, and ideas are supported by rationale rather than opinions. And this kind of helps develop clinical thinking. Before I go into a patient's room, I'll always think, okay, what's the evidence or what's the research that I'm going to do this? Why should I provide oral care before I give this trial? Why am I going to suction this patient before I do this? This helps you create more effective reasoning behind what you're doing and your recommendations. You can use clinical observation, you can use patient presentation. I know this is specific to like an acute care, but you can apply this to anything. Use what you know and also evidence-based practice to just support your recommendation. It helps colleagues understand your perspective, and it also gives you credibility. So next, make sure you're advocating for yourself and for your patients. And a key principle is if you see something, say something, especially when safety can be compromised. Safety relies on you sharing your observations, even if it feels silly. I'll share a quick story. One time very early on in my career, I was evaluating a patient. And at this time, I still felt very insecure about my chart reviews going in. But I had evaluated this patient bedside, and I'm doing an oral mech exam, and I see that the left side of their face is asymmetrical. They have a little bit of a droop. I didn't remember seeing that in the chart. And so I thought, oh, I must have missed it. Something must have been wrong on my end. Maybe they have Bell's palsy and I missed that. I didn't know what that was at the time, but something in my gut told me this doesn't look right. I didn't remember seeing this. So, I'm just going to mention something. So I talked to the nurse and I said, I'm seeing this left-sided facial droop. I don't remember seeing it in the chart. And I also talked to the doctor. Well, they ended up getting additional imaging, and it came out that that patient had a right-sided stroke that had evolved while they were in the hospital. So if I hadn't reported that, if I had truly succumbed to being insecure, then that person may have gotten help a little bit later. So if something doesn't seem right, it's not only appropriate, but so necessary to raise concern. Also, advocacy means that you're being an active listener and you're being intentional with your listening. Patients will often communicate things very subtly through subtle concerns and questions and behaviors. So truly listening helps understand the needs of your patients or even the needs of people around you. This doesn't even apply specifically to patients, but also your friends and your family and coworkers. This can help you identify clinical and social factors that can impact care. Also, make sure you're protecting yourself and your license via clear documentation. This is not just a requirement, but this is often a clinical and legal requirement of the job. It's a record of your observations, reasoning, and recommendations. And accurate documentation will support continuity of care. And it communicates critical information and protects your license. When I'm documenting, oftentimes I'll say exactly what I'm seeing, try to be as objective as possible. If I'm talking to a nurse, I'll say this nurse was notified, discussed with nurse via telephone or whatever, just so that you're protecting yourself and being clear. Another really important life lesson is that your professional reputation develops early. And you might feel this already as a student, entering a classroom. So make sure that you're being a team player. People will very quickly form impressions about you based on how you work and interact with others and based on how you handle responsibility. So healthcare and sciences in general are very highly collaborative. You will work on teams, in groups, you will work in labs with people, in hospitals, in schools, whatever setting you end up in. It's very highly collaborative, and oftentimes the goal relies on teams working together very effectively. So support your colleagues when needed, contribute positively to the environment, and celebrate wins together so that you're receiving the support when it comes to your turn to celebrate an achievement. Also, be a good coworker. And this means that you're respectful, dependable, you're being approachable. Personally, I try to remember everyone's birthday. Sometimes if there's holidays, I'll bring in little treats for people, but being a good coworker goes a really, really long way. And then also make sure you're avoiding office gossip. And this can be really difficult, but healthcare or even just working in general is very, very stressful. So it's easy to be negative, but this can really quickly damage your reputation. So make sure you're maintaining professionalism to protect yourself. Another important lesson is that mentorship accelerates professional growth. So early on, experienced professionals can significantly accelerate your growth. This is like a cheat code as a new grad. The best thing that you could do for your career is identify people who have experience who can provide guidance. This might not be formally assigned to you. This can be colleagues that you respect, supervisors, senior staff, anyone whose clinical reasoning that you respect and that feels like it aligns with what you want to get out of your job. Observing how they handle complex situations can be extremely helpful. Mentorships can also help navigate your career. They can help with clinical judgment and flexibility and resilience. You will encounter unfamiliar situations, difficult cases, and challenging workplace dynamics, and these mentors can often give you really good perspective. Also, remember to give back when possible. So something really good in healthcare is that a lot of times there's opportunities for you to take students or to have people shadow you. So it's not just about receiving, but also giving back. Offering support contributes to a very strong community, and that's something that we should all be participating in and giving into as much as we can. So the next lesson is continuous learning is expected in medicine and science. So graduation doesn't mean that the learning is finished. This often just means that now you get to apply your knowledge in a real world context. Evidence technology and guidelines are always changing. New research is always emerging. Treatment approaches will always change, and diagnostic tools can always improve. So make sure you're staying current with the literature on what the best practices are. Ongoing education is extremely important. This can look like continuing ed courses, conferences, case discussions. Make sure throughout your career you're participating in these opportunities. And also know that learning can come from anywhere. This can come from patients, it can come from coworkers, reflecting on complex cases, but this helps you be open to different perspectives. So up until this point, this is mostly just professional life lessons, and early on you will learn a number of life lessons as well. So working in healthcare exposes you to very high pressure situations, complex personalities, and emotionally demanding environments. So this teaches you not just about yourself, or not just about your profession, but about yourself as well. So the first life lesson I learned is taking perspective and having discernment is key. Professional disagreements will happen, unfortunately, and different clinicians will have different opinions than you. That doesn't mean that anybody's wrong. It just means that people have different levels of expertise or different perspectives. So don't take them personally. Make sure that you're prioritizing evidence over emotion, and don't make them personal conflicts. This is just something that happens, when you're working in the field. Avoid internalizing others' behavior. Healthcare can be really stressful and colleagues will be very short and frustrated with you. This is definitely something I experienced with some of the physicians, but people's reactions are more about their own stress or circumstances more than it's about you. And then also identify what is within and outside of your control. So you can control your preparation. You can control how you communicate to others, your decisions, what you know. You can't control how others are reacting, how others are behaving. You can't control complex, situations that are health situations. Those are not things that are within your control. And distinguishing helps you maintain perspective and helps you avoid emotional stress. So also be strategic about the opportunities that you accept or decline. It's very common, even as a student, that you feel like you need to jump on every opportunity. Even as a new grad, I felt like I had a lot of pressure to take a lot of projects, committees, responsibilities, because you want to prove yourself, you want to prove that you're a good worker and that you have a good work ethic. But not every opportunity needs to be accepted. Some opportunities are valuable and some won't be valuable. So just make sure that it aligns with the goals, and that it's fitting within what your long-term career goals are. There's a risk that they will stretch you thin, or burn you out. So make sure that you're just being very strategic and you're reflecting really heavily on the goals that you're accepting. It's also important to separate identity from occupation.
share.
Oh, you think you have to make me like a whole so a day in my life. Um, because I work inpatient and outpatient, a lot of the morning is inpatient work. So I get to work, the first thing I do is open, see what type of orders we have. And then I'll do chart reviews for those patients. I will go upstairs, and see all of the patients and treat them, do assessments, do treatment plans. Sometimes I'll look at follow-up lists and I'll follow up with patients that, are post-stroke or geriatric patients. And then in the afternoon, because I do outpatient, we have a very hard cutoff. Typically around 3:30, we get a lot of outpatient pediatric kids right after school. So at 3:30, I start my outpatient work. So I have back to back to back. We have 30-minute sessions, and I'll usually go from 3:30 to 7:30. So I work 5 days a week. A lot of my hours are very different. Like one day I come in at 11, leave at 7:30. Another day I come in at 8 and I leave at 4. And that's a very inpatient heavy day where I'm not seeing a lot of pediatric patients, but I'm spending a lot of my time in the hospital working with the acute care patients. So it's definitely, it varies day to day, but I feel like it is a really good mix of everything. Okay. Alrighty. Sorry about that. That's okay. All right. Any other questions before I talk about the importance of opportunities? So, I was saying, ask yourself if the opportunity fits within your short-term and long-term goals. And this takes a lot of reflection so that you can understand what your short-term and long-term goals are. But if the opportunity fits within and you feel like it's advancing you professionally, even personally, maybe it can give you personal benefits, then it's something worth taking. But don't feel pressured to take every opportunity that comes your way. Be thoughtful because this is really important for long-term job sustainability. Let me see if I can do that. Okay, perfect. And make sure you're respectfully declining if you're declining opportunities. So also, this is a big reality. Not everyone will be supportive or collaborative. And I think, growing up and just being in school, the school environment, when you're going from middle school to high school, there's step up day. And when you're going to college, there's a team of people with balloons. And then, you graduate and there's this big celebration. And then you go into the workforce and I go up and I say, hi, my name's Nicole. And the secretary goes, okay. Not everyone will be supportive or collaborative. And this is just reality. This typically has nothing to do with you. So you will learn to manage very difficult personalities. And this can be reflected in any part of your life, personally, within family and friendships. Healthcare specifically brings people with many personalities together. And there will be people who are supportive, but collaboration will be really challenging with people that aren't. And you have to learn to kind of navigate around that. Make sure you're
Yeah, yes. Everyone's muted.
I can tell like a quick story while we're waiting.
Oh,
Never mind, I don't think I want to.
Let me turn that down. Okay.